Um, before playing my video, let me just give you a brief overview of our Group 6. Actually, Group 6 represents 6 hospitals all located in the southern part of Thailand. And in Phuket alone, we have 3 hospitals, which is Bangkok Hospital Phuket. Bangkok Hospital Phuket is the tertiary care hospital and positioned as the headquarters of our southern group. And together with that, we have Bangkok City Road and the Group Hospital. Far south, we have Bangkok Hospital Hat Chai, Bangkok Hospital Samui, and Bangkok Hospital Suratani. So all in all, these are all located in the island of Phuket. And to answer your question, Tim, just prepared a short video to show to our audience all the initiative and new services that we launched since the COVID-19 started a few months ago. So let me show you the video.
In the wake of COVID-19 outbreak, Bangkok Hospital Phuket has enforced strict medical measures to cope with the current situation, with the aim to boost patients' confidence and ensure safety to all the clients. This measure consists of the following. Measure number 1. Minimize viral infections with the use of protective gear. All our medical professionals have to wear the professional protective equipment, or PPE, whereas non-clinical officers have to wear a face mask and face shields while on duty. This can help prevent the infections, along with our hospital recommendation to keep around 75 to 100 centimeters distance between passengers in an elevator. Measure number 2. Draconian disinfection in public areas and patient touchpoints. Target areas include consultation rooms, elevators, ATMs, railings, escalator, handrail, doorknobs, toilets, waiting area, wheelchair, ambulance. This can help prevent infection from physical touch and droplet transmission. Using high-quality disinfectant solution up to international standards. Measure number 3. Reorganize entrance and exit for all visitors. The single-channel policy is currently in place to control people's traffic at hospital with a clearly separated entrance and exit. Compulsory thermal scan is required for every visitor coming in, along with the screening station by our nurse team. Moreover, alcohol sanitizers are available hospital-wide. As for face masks, especially surgical masks or the green ones you may often see at the hospital, please kindly note that they will reserve for patients with medical needs in the first place. In case there are patients that fall into respiratory disease category, our hospital has clearly designed a special and isolated pathway toward the fever and acute respiratory tract infection clinic. They will be transferred by our specific vehicle, which will disinfect every time after use. Measure number 4. Medical readiness in anticipation of patients at risk of COVID-19 infection. The fever and acute respiratory tract infection clinic has been set up to provide one-stop medical services from diagnosis and X-ray to laboratory and medicine prescription. The clinic is operated by a team of medical specialists and nursing staff. Air purifiers are also in place in all the rooms in use. In case of high-risk patients, they will be taken to an isolated room, which is a negative pressure room to control infection. Measure number 5. Our policy is in place as to risk exposure or arising symptoms in medical professionals and hospital staff. Our hospital has enforced preventive measures for all staff, especially those who have traveled to high-risk countries. These include regular follow-up and reporting to our central command center. We are teleconference over the 14-day quarantine period. After that, there will be daily body temperature check for the next 15 days. Measure number 6. Training and knowledge circulation for medical professionals and hospital staff. We strive to equip them with up-to-date knowledge so that all the patients will receive the best of care for their health. Measure number 7. Effective reporting system for international communication. Along with our close collaboration with public health authorities, we have set up a central command center for effective communication and assurance of the current situation. resulting in our operational realignment in good time. This is all the medical readiness at Bangkok Hospital Phuket in the wake of COVID-19 outbreak. We have a strong belief that it will boost the peace of mind for you and your loved one whenever you step in our hospital, because your safety is our priority.
Thank you for watching the short video.
In the wake of COVID-19.
This is just a summary of the video, the 7 initiative or new services that we launched, but let me show you the real actual photos. So we implemented the simulation-based guideline testing from screening to screening triads and to a PU ward until to operating room. And this is some of the training, actual training that we launched a few months ago to really treat our COVID patients, to make sure all our patients will be, and relatives are safe from the infection of COVID-19. And regarding the remote services, this is one of the options that we provided a few months ago to our patients, like the telemedicine or virtual consultation. And this is also the other services that we launched. It's the drive-through medicine and home delivery medicine. We found out that during this outbreak, and there's a lot of lockdown in our area, because I think some of our patients heard that Phuket is in the red zone. So these 2 services actually is becoming one of the solutions that able to help our community. We also provided the free ambulance service during the lockdown period. And right now we are increase our ambulance and drivers to accommodate the demand. And in addition with that, regarding the PPE, I think everyone heard that there's a lack of protective device. So we set a team and we were able to open a mini PPE in-house factory, which our team at the moment can produce about 200 to 300 PPE per day. And we also created our own protection shield, which is, as you can see in the picture, isolation stretcher. And also in our safety policy, we added one code, which is IC move code. And this code will be announced by all throughout the hospital to inform all patients and teams, especially, that there is a patient on the way from screening to PUI ward. And also, as part of the support in our community, this is just to show you one sample of our collaboration with the Thai government. With the help of Bangkok Airways, we airlifted the 52 medical team from Songkhla to assist in our second field hospital here in Phuket. We also donated few protective equipment to some government hospital in Phuket. And also one of our hospitals, which is Bangkok Civil Hospital, we can perform our own COVID test here. And now we are helping the government hospital or the provincial hospital to do the mass COVID testing here in our area. Yes, Steve.
Thank you, Neil. That's interesting, and particularly collaboration with the Thai government as well as the local university in Phuket in terms of helping with that second field hospital in Phuket. And sounds like similar to the story with Samiti Vej, we're trying to help the public health system as well at this time. So that's good. Thank you very much, Neil.
Thank you.
Now let's move to the north of Thailand. We have 2 BDMS hospitals in the north, one in Chiang Mai, the other in Chiang Rai. I'm delighted to be joined by Dr. Anjana. Dr. Anjana is a pediatric pulmonologist, and she'll tell you now a little bit more about the extra precautions Bangkok Hospital Chiang Mai has taken to fight COVID-19. Dr. Anjana, I just read actually this morning in the paper there have been no more cases of COVID-19 in Chiang Mai now for I think 14, 15 days, a long time. And also it seemed like the number of cases in Chiang Mai, it took a while before Chiang Mai became affected, longer than, for example, cases in Bangkok and Phuket. how did Bangkok Hospital Chiang Mai use that additional time at the beginning of the pandemic to kind of take extra steps to prepare for COVID-19, both in terms of patients as well as the staff using the hospital?
Right. Well, first of all, good noon to everyone, and thank you very much for the opportunity here to speak with you. To answer your question, my slide presentation will give you an overview of what we have done so far and our continuing improvement in our facility here, and ongoing improvement. Though we have not had that many cases initially, but so far we have had a lot of tourists who visited Chiang Mai since the pandemic, and we've also had them come in as what the government clarifies as a PUI, which is patient under investigation. So these, some of the implemented things that we've done in our hospital, in our facility, have been according to the CDC guidelines to make sure that we ensure the safety of those under investigations, patients under investigation, and also for the ongoing care of the non-COVID patients. So allow me to recap a few things here, and then at the end, I would also like to talk about a little bit about what do we know so far among the pediatric cases all around the world and here, and what are we looking for, and what all can we do to make sure these, the health and the safety of our children. So, as per the CDC guideline, the preparedness of COVID-19 comprises of, preventing the spread of infection, being able to promptly identify and isolate those patients. At this time, luckily, there is not a major outbreak here in Thailand. We are really, really lucky, and I think part of it is because we've had enough and ample time to prepare ourselves, to understand the disease, and be able to bring those data into work and to help us be able to care for these limited number of cases and be ready for the escalating outbreak. The most important thing is to monitor and manage our health personnel and have an effective communication going on. So as per that mentioned guideline, our hospital has also implemented and designated an upper respiratory illness clinic, an ARI clinic within our facility, both separated for adults and for children, for kids. And we accept phone calls, appointments, walk-in patients who will be screened at a screening point at the entrance. Not only patients that are screened by taking their history and also by doing the temperature measurements, visitors are also screened. Our healthcare personnel, doctors, nurses, and all the medical staff who walks into the hospital, into the building, will be screened as well on a daily basis. There is a separate pathway to the COVID-19 treatment and checkup area for those who are under PUI, who falls under the category of PUI, where many doctors have listed earlier. And for those who just coming in with fever and respiratory illnesses, will be designated to the ARI clinic. We also have switched one of our floor to convert it into a cohort ward in order to be able to accept patients, those who are either under PUI or coming from ARI clinic and being admitted here while waiting for their lab results. So that cohort ward is equipped with a negative pressure room and to be under isolation. Not only that, we also coordinate with our local healthcare authorities here in taking care of COVID-19 patients. So we have been going back and forth with them, having cases of PUI, and also those cases in terms of setting up the healthcare and help, both helping the government when they would need us. So we are all prepared for that. And the most important thing, the other thing that's quite significant here would be the care, the ongoing care for the non-COVID patient. So Well, as I mentioned earlier, that though we have a pandemic going on of COVID-19, but the care for the non-COVID-19 patients should not lag behind. So we have to continue these cares. We've also implemented the telemedicine for a follow-up of or continuing care for patients who need that, like hypertension clinic, diabetic clinic, thyroid clinic, as well as child health supervision. We set up a telemedicine prior to them coming in for their appointment visits. Some patients who do not require to come in, we also have a home delivery for medicines. For kids who need their annual vaccinations or their as per their age group, we have a telemedicine, discuss all the things that we would always do in our clinic, but we help them with telemedicine. We shorten the duration of their stay in the hospital. So a day ahead, we'll do a teleconference and talk to them, to the parents, find out all the information we need, discuss all the plannings in terms of their diet plan, their development plan, what do we do, and so on like that. The next day when they come in for their vaccines, they can just call ahead of time, 15 minutes ahead of time. Vaccines will be prepared. As soon as they come in, check up, vaccines done, payment online, and they can leave the premises within 15 minutes. So that's something that we have guaranteed them. Not only that, for walk-in patients who are unwell due to other reasons, we maintain our usual and regular clinical hours. Another important thing is that to continue doing our elective surgery. In order to be able to do that, we also have been, well, we are quite happy and lucky that we are able to do these COVID-19 screening tests, and all the patients who are undergoing an elective surgery have complied to that. And so this will help ensure the safety of patients being admitted into the hospital in the non-COVID ward, and also the safety of our healthcare personnel as well. Now, the last thing that is really critical and important in the whole picture here is our own facility, preparing our own facility. So the time that we have been able to, for the past 2 months, in going through our, our stockpiles and maintaining adequate PPE, our masks, our usage of all these equipments for our staff, and also having this ample time has helped us making sure that all our nurses and medical authorities and people here, doctors and nurses, are all equipped, have trained in putting on and taking off PPE correctly. Because I strongly believe that if you do things correctly and safely, we all will be safe here as well. The ongoing training for staff, and we also still maintain the physical distancing and promoting a frequent hand washing culture within our facility here. Now, let's touch up upon what do we know so far between COVID-19 and our children and the health of our children. So these informations have come from, I reviewed this from CDC, and these are information that's updated until April 17th of 2020. Now, pediatric population do get infected from COVID-19 as well. No one is immune to this, so everyone is at risk. But relatively, there have been far fewer cases of COVID-19 among the children. So far in the United States, we've had only about 2% of cases. In China, 2.2% of all the confirmed cases. In Italy, 1.2%, and Spain, 0.8%. For these countries abroad, they declare children population of pediatric as under 18, whereas in Thailand, the cutoff point is under 15. Okay, let's see. Well, no, because of the limited and fewer cases, there's no clear cut in terms of their incubation period, but it's still believed to be approximately about 14 days. And of all these cases that have been reported, they have been a strong correlation with someone in the family being diagnosed with COVID-19 prior to these children being sick. So it's very important to know that it's it tends to be from adults in the family who contract COVID-19 and passes on to their children at home. Now, the clinical presentation of these children cases, now luckily, for some reason, kids all have very mild symptoms. There's been hardly any admissions in the ICU, having to intubate them. Most of the cases are very, very mild. And the symptoms include fever, runny nose, nasal congestion, cough, sore throat. Only a few number of them developed mild cases of pneumonia. Now, yes, yes, the most important thing that we can't forget is that there are a lot of people and kids as well who actually contract COVID-19, but turns out to be asymptomatic the whole time. Yeah, so there's a large population who are, and that's why we still have to continue our physical distancing. We still have to stay at home. It's really important to wash our hands thoroughly, because there is a large number of our population infected with COVID-19 that present no symptoms at all. They're not sick, and they can still spread infection. For kids, due to having, well, in general also, there's no current specific medication to treat COVID-19. In adults, they've been on trials for many, many medicines. Either it's an antiviral in terms of anti-HIV, or trying to use anti-malaria medicine, chloroquine, to treat this, but still we don't have a summary of which medicine would be quite effective for COVID-19. Luckily for kids, because of their mild clinical symptoms, they've largely been just needing the supportive care, anti-fever, anti-runny nose, some mucolytic to help them bring up their phlegm and clear it out, and eventually they recover. Now, I believe that there would be people who are concerned about kids who have underlying illness, such as adults. So we know for a fact that adults who have underlying illness are prone or are vulnerable for infecting and having a serious or severe COVID-19 infection. Yes, kids who have underlying illness should also be under the vulnerability of having severe cases, but excuse me, unlike influenza or RSV that we have seen in the past, that just the virus infection itself can cause exacerbation of asthma and things like that. But with COVID-19, we have not seen those pictures at all. And because of the number of kids being infected are so minimal, that we still have to wait and see and gather more information about the morbidity on kids. Whereas the good news is that the mortality also appears to be very, very low. Up until March, there's been only one pediatric death in China. Up until mid of March, there's been none in Italy or Spain. And so far, as of April 2nd, there's only been 3 deaths in the US. One of them is still under investigation, whether it's really associated with COVID-19 or was it a complications of surgery. So anyhow, it's still somewhat of a good news that our pediatric population don't get it so severe, and there's a very, very low mortality rate. Yeah, thank you.
Thank you. No, that's interesting. And a couple of the attendees sent in some questions around children and what does this mean for children, and why are fewer people getting it, and why is the mortality rate lower? So that's interesting. Thank you very much. Let's now turn to Cambodia. And BDMS has 2 facilities in Cambodia, and both of these are really seen as the kind of destination private hospitals for expats in the country. Dr. Virenrat is an internal medicine specialist, and she's also the head of the Royal Phnom Penh's Hospital's COVID-19 task force. And I believe that so far, Doctor, the hospital has managed around 10 cases of COVID-19. So please, Dr. Virenrat, can you walk us through the early steps you took as head of the COVID-19 task force at that hospital to prepare the hospital for COVID-19, the different governments you engaged? And I understand as well that the guidelines are slightly different in Cambodia versus Thailand, so it might be good for you to tell the attendees how things differ in Cambodia. Thank you.
Okay, so good morning. I'm Dr. Virurat from Royal Phnom Penh Hospital. Okay, so today, thanks for being here and also giving me opportunity to share my experience with you about the COVID cases in our hospital. So today I'm going to wrap up what we have doing since January 2020. And okay, so right now, as you know that in Cambodia, the workflow is quite different from Thailand. So I'm going to explain you in detail later. Okay, so for now, as on April 28th, today, Cambodia has recorded 122 cases confirmed COVID-19, which right now they are all cured. Okay, and the government has designated 25 provincial hospitals and 4 public hospitals in Phnom Penh as a quarantine and treatment centers. To clarify our position here in Cambodia, we are not the official part of the government as a treatment center of COVID-19. However, Royal Phnom Penh Hospital is the only JCI accredited hospital in Phnom Penh, and we have been working with many expats and international insurance for a long time. Since there is a record of the case, COVID-19 case in Cambodia, we have been asked from the expats or from many embassies or consular to accommodate their own citizens who are not comfortable to stay in public hospital. Even some Cambodians have asked to stay in our hospital as well. Okay, so since the first case of COVID-19 admitted in Royal Phnom Penh Hospital, we have been working with alliance with WHO team, CDC, Pasteur Institute of Cambodia, which is the laboratory unit, the biggest laboratory unit in Cambodia, and many embassies to accommodate the surge of the COVID-19 cases. Okay.
Putting your staff, Dr. Virenrat, that's very interesting. And so staff competency as well as the physician. So how does that work?
Sorry, can you say it again?
Yes, please. Yeah, please explain how you're supporting your staff right now. This slide, please.
Oh, okay. So we also created the training program by the qualified staff from infectious department as one of the essential part of the JCI standard. We provide training to health workers on updating in clinical practice guidelines based on WHO, CDC, or Ministry of Health guidelines. And also we have a demonstration of how to wear or how to remove the personal protective equipment correctly, as known as PPE, to make sure that our staff will get the best protection. Okay, this is a sample of the case definition launched by Ministry of Health in Cambodia, which I think is quite different from Thailand now, and they're still using this one as a standard to tell who should be tested for PCR testing. And this is the treatment option that also launched from the Ministry of Health. But for your information, before we start any treatment to the patient, we will inform them with the, as you know that right now there is no any standard guidelines. So we will inform them that we have some of medicine that that many countries use it right now, but it might or it can be effective. So the patient, they have the right to take or not to take the medicine. Okay, and we have organized the system as to screening the patient, not only the patient, but everyone who enters to our hospital at the front door, by screening body temperature, by asking the patient whether they have any respiratory symptoms or not, or the history of traveling. And then we also set up the ARI service in the front door which helps to isolate the suspected case from other patients. Okay, so since we have collaborated with Pasteur Institute of Cambodia as the only laboratory unit that is approved by government to run the COVID-19 test, we are able to collect the sample from nasal and throat and then sending the specimen for PCR testing to the Pasteur. The turnaround time takes around 1 to 3 days. And soon we get the result, we will call to inform the patient and advise them about the treatment or medication as needed. Okay, so here I will explain to you the flow. This one is different from Thailand. Expect we have any questions regarding to COVID-19 in Cambodia. Please, we are willing to help you. But once you are diagnosed with COVID-19 infection, firstly, you may need to go to the public hospital as a quarantine center, especially if you are not in Phnom Penh. And secondly, you need to inform your national embassy or your insurance or your tour group or anyone who can contact with the Ministry of Health to inform the formal letter and then send to Ministry of Health to ask for the permission to move you to the Royal Phnom Penh Hospital. And once you are approved, you will be transferred to Royal Phnom Penh Hospital by via public ambulance, or you can ask our ambulance to pick you up over there. Okay. Okay, and once you arrive in Royal Phnom Penh Hospital, you will be transferred via the isolation tract directly to a negative pressure room, which is located in isolation ward. And then in negative pressure room, we will provide you CCTV, vital sign screening monitor, and other stuff that you need during daily use. For CCTV and telephone, we provide you to minimize the risk. Minimize the contact time between patient and our staff, and also minimize the usage of the PPE as well. Okay, this is the isolation ward. Okay, so just to inform you that right now we have 12 negative pressure room and 8 respirator to accommodate the surge of COVID-19 patients. In case you turn into severe pneumonia or you have multi-organ failure, we will work as multidisciplinary team, including internists or pulmonologists, cardiologists, or other specialists as needed. So all 10 cases that have been admitted in Royal Phnom Penh Hospital never deteriorated into severe case that need the respirator, not death. However, life in a small room is quite difficult. Some of my patients suffer from the mental health problems, but which we can provide the teleconsultation to Bangkok headquarters to see the psychiatrist and talk by the phone and for the best care. Okay, and this is the discharge process. So once you meet the discharge criteria, like following these 3 criteria below, like no fever for more than 3 days, improved of respiratory symptoms, or negative of PCR testing 2 consecutive times, we will inform to Ministry of Health by calling Dr. Lee Sawan, who is the leader of infectious control in Cambodia, to ask them for the permission to release the patient from the hospital. And we also contact to the embassy to prepare the immigration process in case you need to fly back to your country. So once you are being discharged, we will give you a medical certification, discharge summary, and home medication as needed. In case you live in Cambodia, after being discharged, you need to do home isolation for another 14 days. And on day 13, the government will ask you to repeat the COVID-19 test again. But if you are living abroad, I would suggest you, after you arrive home, travel back home, and then you should continue isolation at your home for another 14 days. Please plan in advance in case you get COVID-19 infection in Cambodia or any other diseases. We are willing to help you through this situation. Thank you.
Thank you, Dr. Virenrat. And that's interesting because I think there's a lot of unknown about Cambodia, and now you've cleared up very nicely.